The Border Management Authority is currently implementing a screening process at the ports of entry amid rising cases of Mpox in the country. Health officials have developed an outbreak preparedness plan to deal with Mpox. Now, this is in response to the 16 cases that have been confirmed by the National Department of Health. For more on that, let's now welcome Mr. Murdock Ramathuba, who is BMA Assistant Commissioner for Specialised Services. Murdock, a very good afternoon to you. Thank you so much for your time. So, talk to us about what screening measures are currently in place at the borders in order to detect Mpox, and which ports of entry are also heavily affected.
Good afternoon to you and the listeners. The screening processes that we are doing in the ports of entry, it's what I think you already know. We've got thermal scanners that we have in the ports of entry that we have been using, I think, for the past decade or so. So what happens is that when people or travelers come through our ports of entry, the thermal scanners are able to pick elevated temperatures from such travelers, which could be because of any illnesses. It could be a number of illnesses that are associated with fever. So when that happens, these people, we then isolate them. Our port health officials in the ports will do basic non-invasive observation of the symptoms. And then in those ports of entry where we've got clinics such as Lanseria and OR Tambo, we've got nurses that are available to do further assessment. If we've got suspicions that people could be sick for whatever condition, including Mpox, we could then refer those people to the nearest health facilities. We've got arrangements with the emergency services, both from the 9 provincial departments of health, as well as the private sector and the hospitals where such people will be taken and be treated or managed by the Department of Health further.
And then if you find such a particular person, Murdock, is actually testing positive at the entry, what is the process that then ensues, and how long is the period for which they can then start again the process of application to re-enter the country?
Okay. Firstly, we do not test them for the disease at the ports.
Okay.
We assess the temperature elevated for fever, which could be a sign for any disease. And we do not restrict people from coming into the country. However, we refer them to the health facilities for further management and treatment if the health department will deem it fit that they need to be subjected to treatment after they've assessed and they're convinced that the people are positive. In terms of testing, it will be the Department of Health, of course, and the Institute for Communicable Disease that manages that. I think the statement by the Department of Health does cover the role that they play that side. So our role is just generic management of the ports. That includes prevention of importation of diseases and all diseases, not necessarily Mpox. That's what we were also trying to emphasize in previous engagements, that those scanners are not there for Mpox. They are there for any condition in the ports of entry. I think it's critical for people to get that part right.
Absolutely. Thank you for that clarity, Murdock. So now talk to us about if there's any plans that will actually enhance screening measures or to implement new technologies in order to detect any types of diseases. As you've just mentioned, it's not just Mpox at those ports of entries in the near future.
Yeah, that is the vision of the Border Management Authority, to say we believe that for us to be able to manage the ports better, we need to look towards the use of technology. The technology that is there, not necessarily only for diseases, but for even just for patrolling the borderlines, because we've got over 4,441 borderline that is there. There is no way you can mend it with people standing on the border. So, but if we've got devices, technologically advanced devices, we're able to use that. Other things that we're doing now is buying drones. So, of course, with the guidance from the Department of Health and the international health regulations, we should be able to find something that we can use in terms of advanced technologies to deal with the management of the ports of entry as far as health matters is concerned.
And then are there specific protocols for travelers from outside of South Africa, Murdock? Talk to us about how also the information about these various diseases, including Mpox and as well as other prevention measures, are actually communicated to travelers from outside the country.
The National Department of Health and its provinces are the lead agents as far as health matters in the country are concerned. And with the NICD being an institution that supports the department with various researches and related matters as far as issues of communicable disease is concerned. And with regard to the Mpox that we're having, I think we're already aware that there's been no report of any disease that came from outside the country. We've got local cases that we're dealing with in the country. So that's why what we're doing in the ports of entry, we don't see it as a target on Mpox, but on any other diseases. The critical matter that we need to note is that the World Health Organization has not given any travel restrictions, because it is only when they've deemed it fit that we should restrict movement because of the particular disease, where we then as countries follow that, and us as an agency that is implementing or enforcing prescripts of the National Department of Health in this matter, we will follow what the Department of Health tells us to do in the ports of entry.
Murdock, thank you so much for your contribution this afternoon. That is Mr. Murdock Ramathuba, the BMA Assistant Commissioner for Specialised Services, weighing in on, of course, the screening processes that are currently being conducted at ports of entry.